At New York Presbyterian, we pride ourselves in putting patients first. And we do that not only by looking at the workflows of the clinicians, but by also examining the workflows of our patients and families. We do that by deploying and testing easy-to-use, engaging tools like the TelaDietitian nutrition platform. We're excited to work with the forward-thinking team of TelaDietitian to pilot video nutrition consults in our Executive Health Services Department at New York Presbyterian Hospital. I am proud to welcome and introduce Jackie to tell you more about the TelaDietitian product.
Thank you. Thank you, Victoria. There you go. Thank you, Victoria. And thank you, New York City Digital Health Accelerator, and thank you everyone being here for our demo day, which is so exciting. Hello, my name is Jackie Arnett Elnahar. I'm a registered dietitian, attorney, and CEO of TelaDietitian. What I want to explore with you is my experience as a registered dietitian, where I saw a huge gap in healthcare, a gap in convenient and accessible nutrition consultations. I started my work as a clinical dietitian at St. Joseph's Hospital in Yonkers, and I remember one patient vividly. Her name was Susan. At discharge, we told Susan she needed to see a dietitian for her chronic kidney disease and heart failure. But unfortunately, an outpatient dietitian was in New York City, which was too far for her, and our hospital didn't have an outpatient nutrition center. So, Susan didn't see a dietitian, nor did she get the medical nutrition therapy she needed. Susan's health ended up not improving, and we indeed saw her again in the hospital. I then asked the question many of us ask in healthcare: why was this so difficult? Why was it so difficult for Susan to get the nutrition care that she needed? It is especially alarming when the Centers of Disease Control estimates that half of our healthcare costs are attributed to modifiable behaviors, with diet being the most prevalent. But here's the thing. We can't expect patients to change their dietary habits like a light switch. This is the way they've been eating 10, 20, 40 years. We need to provide the support and resources for patients to change their dietary habits. The support Susan needed. And this is where TelaDietitian comes in. TelaDietitian is the premier telehealth solution for nutrition counseling. We are working with the Academy of Nutrition Dietetics to make medical nutrition therapy easy. TelaDietitian is convenient, it's cost-effective, and it's efficient in providing high-quality medical nutrition therapy consultations via HIPAA-compliant video, chat, and phone portal. And it's so easy to use. A patient signs up to TelaDietitian with their health information. They select a registered dietitian suitable for their health condition and schedule. From there, the registered dietitian calls or video chats with the patient, depending on the patient's preference. After the consultation, the patient receives a personalized nutrition guide with personalized information for their nutrition condition, recipes, shopping guide, recommended supplements, and even with potential food and drug interactions to watch out for. And to further improve access, telehealth and TelaDietitian are becoming more reimbursable by insurance plans than ever before, which TelaDietitian is tapping into. So what if Susan had TelaDietitian? Susan signs up with her health information. She speaks to a dietitian over video on her mobile phone. The dietitian asks Susan to see her pantry, where the dietitian finds many food items with excessive potassium and sodium that were exacerbating Susan's chronic kidney disease and heart failure. Susan cleans out her pantry, and she's so excited that she can message the dietitian easily with any questions, and that she always has access to her personalized nutrition guide. Now that's providing patients with the resources and support they need to change their dietary habits. What is unique about TelaDietitian is that it was made by registered dietitians for registered dietitians who know how to provide the optimal patient experience in nutrition counseling. TelaDietitian uses the nutrition care manuals of the Academy of Nutrition Dietetics, so everything is evidence-based and within the latest medical nutrition therapy protocols. And instead of creating more nutrition noise, TelaDietitian cuts right through it by only providing personalized, curated content that is relevant to the patient and their condition. And we have an amazing growing network of 300 plus registered dietitians that spans nationwide. So a dietitian can speak to a patient in California, if the dietitian's in California, as per state licensing laws. So we have all those nationwide dietitians. And they have a wide expert range of specializations, from chronic kidney disease, heart failure, prenatal, autoimmune, and even a sports dietitian if anyone's looking to train for the New York City Marathon. And now, will it work? We know medical nutrition therapy works. There are many clinical studies showcasing its effectiveness, including one study where half of the patients were able to limit their lipid medication with diet modification. But we just need to improve access and convenience to medical nutrition therapy, which TelaDietitian does. We now know telemedicine works, with many impressive clinical studies in telehealth and teletherapy, including a study of the Veteran Affairs that showed a telehealth program to be both cost-effective and maintaining quality. TelaDietitian is built on a winning formula. The telehealth market is estimated to be worth $34 billion by 2020. And telehealth is already working for physicians, for therapists, dermatologists, and now it's working for dietitians. In the short 6 months of TelaDietitian, we have 3 pilots that we're finalizing with New York Presbyterian, St. Barnabas Hospital, and National Health Insurer. And all these pilots were doing even more new things. At New York Presbyterian, we're conducting a usability study for medical nutrition therapy consultations in their outpatient setting. At St. Barnabas Hospital, we're working in the diabetes center. And for the National Health Insurer, we're working to streamline medical nutrition therapy reimbursement and telehealth and reduce costs. And to do all this, we have a great and dedicated team. We have a Peter Thiel Scholar, cardiologist, dietitians, and seasoned entrepreneurs. We're all passionate about nutrition and what TelaDietitian can do. There are many Susans in the United States and many people who can benefit from medical nutrition therapy, and some of us even in this room. Whether we're a 50-year-old trying to control our cholesterol or a working mother who's trying to better manage the symptoms of Crohn's disease. Access to medical nutrition therapy is going to improve health outcomes, reduce costs, and increase patient satisfaction. If you're interested in being part of this game-changing solution, please come speak to us. Thank you so much.